Today we'll be talking about a condition called fetal alcohol syndrome. Fetal alcohol syndrome, also known as FAS, is a severe form of fetal alcohol spectrum disorder, FASD. FAS is caused by consumption of alcohol during pregnancy, which can interfere with the development of the fetus, which can range in many physical, cognitive, and behavioral impairments. FAS is just part of FASD, which has their specific forms, FAS being the more severe out of FASD, which we will be talking more about today. We have partial fetal alcohol syndrome, which has fewer physical abnormalities, alcohol-related neurodevelopmental disorder, which affects the cognitive and behavioral problems without physical dysmorphia, and ARDBS, which has physical birth defects such as heart or skeletal abnormalities. FAS is a variety of clinical features which can affect a person's physical appearance, growth, cognitive abilities, and behavior. The severity and features can vary on certain individuals, of course. Individuals with FAS typically have a smooth philtrum, which is a space between your nose and upper lip. They have a thin or narrow upper lip. Palpebral fissures are shorter than an average person. Flat midface, shortened or flattened nasal bridge. Small heads, which suggests abnormal brain development. Individuals experience prenatal retardation, having a low birth rate and smaller than average gestational age. They could have intellectual disabilities or delays in IQ scores being below the average. They also suffer from learning disabilities in math, reading, and abstract thinking. They can have attention deficit, memory problems, motor delays, and brain abnormalities. They also have behavioral issues, which social skills problem difficulties with emotional regulation, speech and language delays. They can also have mental disorders, having comorbidity with depression and anxiety or other mood disorders. Living with fetal alcohol syndrome can be very challenging, but with the proper support, many can lead fulfilling lives. Of course, like any disorder, there are spectrums of severity. Some with FAS experience learning disabilities, having problems with memory, attention, and problem solving. Children with FAS can show delays in speech or language development and struggle with typical academic tasks. They also can suffer from behavioral issues such as impulse control, leading to risk-taking or trouble following social rules. This can affect relationships and social integration. They also experience deficiencies in growth. These individuals can experience depression and anxiety. Individuals with FAS have difficulty living independently due to the cognitive, emotional, and behavioral challenges. They could need continued support from family members and caregivers, and some achieve some degree of independence but often need assistance. Finding and maintaining a job can be challenging as well, needing accommodations and help manage certain tasks. There was a little girl named Brianna who was 4 pounds and 11 ounces at birth. Her parents had adopted her and later noticed some difficulties, such as wanting to play with children much younger than her rather than her own age. She wouldn't understand some social cues as well. Brianna later was diagnosed at 12 years old with FAS. After being diagnosed, her family and community were able to support her in better ways, seeking treatments and providing therapy. Now she is an advocate for other individuals with FAS. Individuals with FAS typically are diagnosed at age 7 to 9 years old, with males typically getting diagnosed earlier than females. The CDC estimates that FAS occurs in about 0.2 to 1 per 1,000 live births, though some studies suggest that the broader range of fetal alcohol spectrum, a FASD, may affect 1 to 5% of live births. The most likely shows that FAS is underdiagnosed compared to the broader FASD. Because FAS is a lifelong condition, the only treatment are certain therapies and interventions. They are most effective when targeting certain symptoms and impairments rather than the condition as a whole. Using therapies such as 1. Early intervention services for children who are 3 years or younger. This can help aid specific symptoms, but your child has to qualify under the Individual with Disability Education Act, or IDEA, which depends on each state. You have speech therapy helping with speech development, receptive and expressive language, and communication programs for nonverbal or help develop language within the child. Occupational therapy, using toys and specialized tools to promote motor skills development. Behavioral therapy to modify specific behaviors and reinforce positive actions. There are, of course, also protective factors that can help, such as early diagnosis, supportive and nurturing families, and nonviolent environments. Living in a home that is unstable and has violent or abusive characteristics can lead a child with FAS to manifest their anger in a harmful way and could create secondary conditions such as substance abuse, where a third of people with FAS suffer from having problems with drug or alcohol abuse and tend to be reoccurring inpatients. Teens and adults with FAS also have a higher risk of having encounters with law enforcement, having difficulty regulating anger or other negative emotions. This and their difficulty understanding motives of others can have them involved in violent or inappropriate sexual behaviors. If a victim of violence, they are at increased risk of having inappropriate behaviors like unwanted touching. They also have disruptive school experience, so individuals with FAS have trouble with school already, but being in an unstable home can increase the risk of being expelled from schools and having issues with other children lacking the social behavior. You have certain causes. Here we're going to be talking about 5: the maternal alcohol consumption during pregnancy, timing and an amount of alcohol exposure, genetic and biological factors, environmental and lifestyle factors, and other substances. This is the primary cause of FAS, is drinking alcohol while pregnant. The alcohol, which constricts blood vessels, slows blood into the fetus via the placenta, which can disrupt the normal development of the baby's brain and other organs. The body also produces a toxic byproduct. These can concentrate in the baby's brain cells and cause damages or malformations. Alcohol is a teratogen, which causes abnormalities in the fetus development. It also interferes with cellular growth, the formation of neural connections, and the proper development of tissues and organs. The timing and amount of alcohol consumed plays a significant role in the severity of FAS. Drinking in the early stages of pregnancy, during the brain and organs are being rapidly developed, can lead to more severe effects. The child is most vulnerable during the first trimester, which is 12 weeks. Different studies suggest very safe alcohol consumptions while pregnant, but even small amounts can aid the risk of developing FAS. Of course, heavy drinking or binge drinking can be particularly dangerous and linked to severe manifestations of FAS. Other substances like tobacco and illicit drugs that mothers consume can increase risk of FAS on top of alcohol. Women who are dealing with significant stress, lack of access of healthcare, or who live in environments where alcohol use is more prevalent may be at higher risk of drinking during pregnancy, which can increase the chance of FAS. Mothers who struggle with addiction or mental health issues, depression or anxiety, may be more likely to drink during pregnancy. Nutrition also plays a role, so poor maternal nutrition may increase the susceptibility of the fetus to the harmful effects of alcohol deficiencies in vitamins and minerals, such as folic acid, and can increase the risk of birth defects, which combined with alcohol exposure causes FAS. Some research suggests that genetic factors may influence the extent to which alcohol affects the fetus, like certain genetic variations in the mother or fetus may affect how alcohol is metabolized or how the fetus brain responds to alcohol. The mother's biological factors and health during pregnancy may also impact the risk of FAS. Factors such as malnutrition, smoking, or pre-existing medical conditions could exacerbate the effects of alcohol. It is still important to know that drinking while pregnant can be harmful to the fetus, where even small amounts can increase the risk of fetal alcohol syndrome. But also, it's important to seek early diagnosis within a child to offer them support and as much of a normal life as possible.